is episode 57 of the Real World Paleo Podcast. Hi everyone, I'm Christine Lehman, a nutritional therapy practitioner and reverse diabetes coach, which is also the name of my website. I help clients reverse diabetes naturally, lose weight, and lower their cholesterol. I also see clients by Skype. The Paleo Podcast is now available on iHeartRadio as well as iTunes, Stitcher, and Google Play. You can buy some great paleo and primal products, including organic skincare, grass-fed meat, and extra virgin olive oil direct from Greece on my website at reversediabetescoach.com. Please remember while you're listening to the show, advice and information we provide is intended to be helpful and informative, but is not a substitute for medical advice or treatment. I'm really excited to have Dr. Marty Skopp on the podcast today. To introduce him to our listeners, Dr. Skopp is a private practitioner serving patients at Skopp Sports Medicine and Chiropractic, Center for Spine, Sports, and Soft Tissue Treatment in Alexandria, Virginia. He has comprehensive sports medicine training and has attained board certification, diplomat of the American Chiropractic Board of Sports Physicians. Dr. Skopp uses the active release techniques, ART, soft tissue approach, extensively in his practice. He began offering it in 1992, making him the most experienced at the process in the greater Washington, D.C. area. Dr. Skopp was personally trained by Dr. P. Michael Leahy, the developer of ART, in his inaugural course on the treatment. Subsequently, Dr. Skopp achieved full credentialing in ART and taught the technique as an ART instructor for 8 years. Dr. Skopp is passionately involved in the sport of triathlon, both personally and professionally. He has provided injury and preventative treatment, including finish line triage at numerous 12 Ironman triathlons since 1992. Dr. Skopp was selected to lead the ART team at Ironman Florida from 2000 to 2005 and was chosen to be a finish line captain at the 2004/5 races. He chaired the American Chiropractic Association Endurance Sports Symposium at the Ironman World Triathlon Championship in Hawaii. Dr. Skopp received his undergraduate degree, a baccalaureate in psychology from Binghamton University in New York in 1983. In 1991, Dr. Skopp received his doctorate of chiropractic from the Los Angeles College of Chiropractic. He received a postgrad degree from the American Board of Chiropractic Sports Physicians as a certified chiropractic sports physician in 1993. So welcome, Dr. Skopp.
Thank you, Christine. It's great to be here and to be with you and all the folks listening in.
Wonderful. We have a beautiful day here in Alexandria.
We do. Sun is out. Love it.
Yes, love it after all the rain. So I'd like to ask you how you became interested in chiropractic medicine.
Great story. So I started off since I was about 4 years old telling my mother I wanted to be a doctor. And I went to college, I hit those pre-med years and started taking courses, and organic chemistry came upon me, and I said, I'm not so sure this is for me. And quickly went away from it and ended up being in the computer field for a number of years.
Really?
Yes. So I started learning more about nutrition and fitness during that time as I started competing in marathons and triathlons. And during that time, I met a sports chiropractor at one of the triathlons I was doing. We became friends. He became a mentor to me, and I actually became a patient of his at some point. And when I started seeing all the wonderful, amazing things that he was able to accomplish with chiropractic, doing this from the sports perspective, I decided that was what I wanted to do. Mm-hmm. So I said, all right, I'm going to tackle this and go back and take all those pre-med prerequisites, go back to school, and I loved all the how I felt after chiropractic and just watching how my body reacted to it. And so off to school I went, took that organic chemistry, tackled it, no problems, and went forward and here I am, I don't know, 25, 30 years later.
Busy too. So maybe you can explain a little bit about your training. It sounds like you had to take pre-med for your chiropractic, your doctor of chiropractic. Is that
Sure.
correct?
To be a chiropractor, most chiropractors, as you'd mentioned, have a bachelor's degree of some sort. We all need the same pre-medical education requirements as any medical doctor or osteopath needs. So that's, for those that don't know, it's a year of chemistry, a year of organic chemistry, a year of physics, a year of biology. I'm probably missing a few things, but it's been a long time. And so I got my bachelor's, and then chiropractic school is it's basically a 10 trimester program, 3.5 years, 10 trimester program where you study pretty much the same things as you would if you were in medical school, with the only big difference being that instead of learning extensive pathological organisms and diseases, we learned some pathological diseases and organisms, and we spend a lot more time learning conservative care treatment, a lot of anatomy, whether that's gross anatomy or histological anatomy or X-ray anatomy, and we learn obviously how to work with people with our hands, and so we take motion palpation courses and learn physically the landmarks of the body, and we get into how to move the spine, how to get the joints moving again. And so that's a period of years and years, and then our clinical training is included in part of that program as well.
So it sounds really fascinating, and I know, going back to the sports side of things, that you've completed triathlons, duathlons, and marathons, and you also use the phrase Ironman. So for the uninitiated, can you explain the difference between these three types of events, and what does Ironman mean?
So Ironman is actually a trade name for a particular event that is a triathlon, and a triathlon is a swimming, cycling, and running event all in one event. And so Ironman itself is 2.4 miles of swimming, followed by 112 miles of cycling, followed by a 26.2 mile run, which is, for most of you know, that's a marathon run. So you have a marathon included. So what I've done is I've actually worked at about a dozen of these from Hawaii to Florida, and I've done many triathlons myself, but not necessarily the Ironman distances. I've done a lot of swim, bike, run events myself.
So what's the longest one you've done?
Oh, yes. So the swimming is, like I said, in Ironman is 2.4 miles. As crazy it seems, some athletes really want to take it to the next level. And if you really want to hear about a crazy event, there's something called a Deca Ironman, which is 10 times those distances. Can you imagine doing an event that's 240 miles of swimming, 24 miles of swimming, 1,120 miles of cycling, and 262 miles of running?
It's crazy.
Amazing what people will try to do, isn't it?
Yes. Has anyone succeeded?
Yes, many. Actually, there's been I think they have about 15 to 20 people do these events. It happens every year, believe it or not.
Wow. So they're willing to keep trying.
I don't understand why, but that's the human psyche for you.
Exactly. People like a challenge. So let's talk about active release techniques. Can you explain the soft tissue approach and how it differs from traditional chiropractic procedures?
Absolutely. So active release techniques is a way to restore the mobility of those soft tissues. The soft tissues get stuck together They don't slide over each other as well as they're supposed to. So what active release does is a unique way to use movement to free up those tissues that are not moving well together. Now, there are multiple kinds of soft tissues. So a lot of people don't know the difference between a muscle, a ligament, and a tendon, or what the nerve actually, how that interacts. So let me explain that briefly. A muscle moves the bone, right? So without muscles, we don't have any movement. But a muscle attaches to the bone through the tendon. The tendon has these hooks on it that actually attach into the bone. So every muscle has two tendons on either side. The ligament actually keeps the bones close together so we're not flopping around. So ligament attaches one bone to another bone. And there's this stuff in our body called fascia. Fascia is ubiquitous throughout our body. Think of it as like anybody who's worn a stocking or a pantyhose. It's a connective tissue that allows all the muscles, one muscle to slide over another muscle. It separates them and keeps them unique. It's also between the different muscle fibers. So what we have found is that, especially in a lot of athletes or a lot of issues with nerves, such as carpal tunnel type things, sciatica, this is when the nerve is actually stuck to either the fascia or the muscle. That happens very often. Think about people who sit at a desk all day and they're in this seated posture that causes a tightening of all the muscles in front of their chest, and then it causes all the muscles in their backside to just go into tightness and spasm. And so what the active release does is it actually frees up that tightness from the front side, which opens everything else up. So think of active release as a massage with movement. What we're trying to do is lengthen the structures over one another so that they separate and then they're freed up again. So we're basically getting movement back into places that no longer move.
Well, that makes sense. And this is not part of traditional chiropractic.
Correct. Not every chiropractor has training in active release. In all fairness, there are physical therapists and even some massage therapists, osteopaths that have been trained in active release, but it is a small population of each profession. And it's unfortunate. I've been doing active release since 1992, so quite a long time, and it's really has grown. There was a period of 7 to 10 years where I was the only practitioner in about 3 states doing it, but now we can look in the Washington, D.C. area and see 15 to 20 people doing that same technique. So it has grown, and it's within professional teams it's well known. Within a lot of the athletic community is well known, but not every practitioner does know about it or has learned about it.
Right. So what are some common physical ailments that ART can relieve?
So the common, well, it a lot depends on the sport you do or what your activity of daily living is. So like I said, the most common thing we see is everybody sits at work, so everybody's got tight neck and shoulders, upper back is a big issue. Like I mentioned, the nerves, the sciatic nerve, the carpal tunnel. I see a lot of iliotibial band problems in runners. I see plantar fascial problems in people that sit all day, or once again, in a lot of athletes, get pain at the bottom of their feet. Of course, back pain is a big thing. People think of chiropractors for back and neck pain, but that is one part of the treatment approach. So from an injury perspective, this approach is unique because it can treat various conditions. I treat shoulders, I treat elbows and wrists, and so it's not unique to one part of the body. We give different names to where the site of the injury is, but they all follow the same sort of mechanism of injury. Mm-hmm. So let's say you have a slight irritation to let's go with the shoulder. Okay, so there's a lot of muscles around the shoulder. Most people have heard of the rotator cuff, which are basically four muscles. And if you're sitting at a desk, or you're a baseball player or a tennis player, and you're using your arm quite frequently, you can actually start getting those muscles to tighten. And when they tighten, there's a decrease of blood flow to those tissues. And those tissues start getting less and less oxygen to them. Something called hypoxia. So when those tissues get less oxygen, there's actually cellular breakdown, and the body has to repair that breakdown. And what it does is it creates a very stable crisscross structure, and it adheres those structures together. And that's great for preventing injury, but it's not so great for movement. So what we find is we have people with all these movement issues that then turn into injuries when they try to move. So they try to move something, and there's a micro tear or even a macro tear. And what the active release does is it frees that tissue up and allows the body to heal.
Mm-hmm. But just to play off of that scenario, do you have to keep applying ART repeatedly if it's a fresh injury? For example, I'll just use myself. I strained a little bit of my lower back area.
Sure.
Some muscles lifting two heavy things coming up the stairs. And then I was lifting my legs up, thinking I was getting more, burning more calories. So I noticed that it was strained. So, would I need ART repeatedly, or how does that work?
So generally what we find with active release is that when we treat the structures, to free them up may take 4 to 6 times to actually really get them freed up. Now, some people take a little more. Some people get freed up right away. And a lot depends on the repetitive nature of what you're doing, as well as your fitness level and how old you are. So that affects recovery time. And so what we also have to work on, so you bring up a point. So active release, we don't just do active release and say goodbye, but when I treat somebody, we actually have to rehab them and actually get them stronger and do the right mobility stretches, let's say, or foam roll, or to get the muscles and fascia moving, to get all the nerves unentrapped. And the corrective exercise is a real important component of making it stick. Mm-hmm. So it is not something that you have to do over and over and over, because these myofascial adhesions that cause the problem in the first place, first of all, they probably have taken months to years to build up. These are not things that happen, I just bent over and picked something up and my back went. No, these are things that it's like a spring that's been loaded and it's been wound up for a long time, and you did one thing and the spring went boing. And so once we free everything up and get the injury healed, there's a part of correcting the problem in the first place. And we have to look at the whole kinetic chain as well. Meaning, if you have a back issue, we have to look and see, hey, are the hips moving well? How is that affecting the back? How about the upper back? How is that doing? So you may not be aware of this, Christine, but the body goes through alternating joints of mobility and stability. And so your ankle is a very mobile joint, whereas your foot is fairly stable. And as most people know, the knee is a hinge joint. It doesn't move around a whole lot in different directions. The hip has a whole lot of circumferential movement. Is the second most mobile joint in the body. And then we talk about core stability, which is everything around from your belly to your back, and that has to be strong. So relating this to your back issue, if your hips are not moving well, it's going to put extra stress on the back that is supposed to remain stable. So you're going to actually overmove your lower back, which is going to cause injury to it. So we can't just correct the lower back issue, but we actually have to get the hips moving better so that the whole kinetic chain is freed up and is moving appropriately. So once again, we need to restore the mobility back in the joints that are supposed to move right that end up not moving well.
Mm-hmm. Well, that makes a lot of sense that you kind of want to address these other, like you know, kind of connective areas, or you call them kinetic.
Kinetic chain, yes.
Kinetic chain, yes. So what we're talking about with carpal tunnel syndrome, I think that's a good example of repetitive motion. Can you explain how that works? I found a definition, but I wanted to hear what, your explanation for it.
So, first of all, carpal tunnel is involving the median nerve, and that's a nerve that affects the first 2 to 3 fingers, and it does both motor and sensory to those fingers, so movement as well as sensation. And the nerve starts up actually all the way up in your neck, goes through your shoulder through a nerve bundle called the brachial plexus, and those nerves break up as it travels down the inside of your arm. The median nerve will travel to the inside of your arm and then go through a muscle called the pronator teres, and then down the middle of the forearm and to an area called the transverse carpal ligament, which is kind of at the palm of your hand, but closer to your wrist on the palm side of it. And when they do carpal tunnel surgeries, what they do is they release that ligament by cutting it. Unfortunately, that doesn't work all the time, or most of the time, because they haven't addressed the entire chain of where that nerve is starting from. And so that anywhere along that chain, that nerve can get entrapped, or those tight muscles or fascia can wrap around or affect the nerve and pull on it. And so what we do with active release is we free up the entire chain of muscles and fascia along that median nerve. And so we start from all the way up in the scalenes, which are the muscles up in the neck, go to that brachial plexus, and then work the chain down to the pronator teres and some of the muscles in the forearm, and then down into the hand and thumb. And once you free it up, then you could do some stretches and, once again, some strengthening that will allow that whole nerve to actually start functioning normally again. I've actually done a lecture with dental hygienists. Think about how much they move their hands. And by the way, when you talk about nerve issues especially, the smaller the movement, the more likely the injury is going to occur.
Huh.
So
I didn't know that.
Think about in the old days, I know I remember it, there was something called a typewriter where you had to press down the key all the way for the key to move. Now we do much faster movements with keys that you don't have to press a whole lot, and we can go faster. So we have higher repetition with smaller movement, which causes actually more injury to the tissue because there's a concentration on the nerves that are causing the injury to occur.
That makes sense.
So did I answer the issue about the carpal?
Yes, you did. The other thing is I read that sometimes these injuries can be permanent or temporary. And I was wondering, do you recommend when you see people in your practice, we can use the carpal tunnel syndrome example, do you find that you're able to get them back if they want, assuming they want to go back to their same job, back into that? Do they need to take a break?
Well, once again, it depends on how long the injury's been there. And so clearly an injury that's been there for a year, 2 years, 3 years, it's going to take longer to respond because the nerve is actually starts to decay slightly because it's not getting the proper stimulation. And so it takes longer for the nerve to come back. So there are some injuries. Look, active release doesn't fix everything, but it fixes a lot of things. And so what I will find, when I work with somebody, if I'm not getting a response within those 4 to 6 treatments, then I'm really have to rethink whether that treatment is going to help. Now, I also use something called instrument-assisted soft tissue mobilization. We call that IASTM for short. And that sometimes can also get into that fascia. And it's these kind of like, you can use like these little steel tools or you can use these polymers that have been made to actually get in there. It's kind of like a piece of china to get into that fascia and break it away from the nerve. So basically, after a couple of treatments, you can tell if this is going to be a permanent injury, or if this is an injury you can help or not help. I don't want to say permanent because, it may just not respond to my care, and we may have to refer to somebody else who can help. I would say that the vast majority of people I see, I don't need to refer to a surgeon. How's that?
Yeah, I was just thinking that. When would you refer?
Yeah, well, clearly if somebody's not responding to the treatment after a short trial, and I mean the response could be even if I don't see a 50% change right off the bat, I'm concerned and think that maybe this is not the right approach. I will not treat somebody over and over again if I'm not getting results because it's wasting that person's time, and quite frankly, it's wasting my time. I want to help people that I can help, and we would know in a very short period of time whether you're going to be helped or not. It becomes very clear.
So, we touched on this briefly, but I'd like to explore this a little bit more, which is more the rehabilitation side. So you get some good results with the ART, but now you've really kind of got some, I'll use myself again. Right now I'm probably not doing a lot of Pilates or, conditioning in my core. So is that one of the techniques you use? And what is your rehabilitation, if that's the right word, process?
Well, there's a couple. For back pain, there's a couple of core exercises that people need to start doing in order to get themselves. So we talk about the right order. Let's talk about the right order of doing things. So, if you're hurt, clearly we need to reduce the discomfort and restore the joint mobility and the muscle mobility so that you can do some of these exercises that are going to help you strengthen, that will create long-term benefit. So, some of the exercises we use, so you may need to first go through something like active release to get those muscles released and freed up so they can move again. We need to get those joints moving again because the actual skeletal joints lose their mobility over time if they are continually locked up. And we may have to free them so that your movement pattern can change and you could actually perform the exercises properly. So if your hips are locked up and I tell you to do squats to improve your gluteal strength or, and start working the core, if that's not freed up, you'll never do a proper squat. And you need to do a proper squat or proper exercise in order to not re-hurt yourself, right? So you want your parts moving properly before you go forward on these exercises. So, yes, Pilates is an appropriate methodology for strengthening. One of the best things somebody who has back issues can do are bridges and planks. Planks are probably the best exercise. Side planks where you hold your body. Sort of, if people don't know what a plank is, it's basically holding yourself on your forearms in a push-up position without doing the push-up.
Mm-hmm.
So planks and bridges, squats, lunges, and then if you identify the areas that need mobility, you can do things like goblet squats and there's a whole host. I mean, I'm not sure I can name them all, but there's a lot of different exercises that can be incorporated based on the individual's needs. And so, I always look at the person in front of me and say, well, what's not moving? What do we have to strengthen? And then the exercise program can be addressed that way. Mm-hmm. So it has to be individualized.
Oh, absolutely. And it seems that for back injuries, that, if your stomach muscles, how much does the stomach matter, your abdomen? Is it important as part of core conditioning to strengthen those muscles?
The transverse abdominis, which are the very, very deep stomach muscles, are very important. We're finding them to be very, very important muscles. People think about, in the old days, we used to do sit-ups to strengthen the muscles of the stomach.
Right.
And we have found those to be very, very poor exercises for improving back health and even abdominal health because, first of all, you're using too much of the iliopsoas muscle in a sit-up. And what that does is it tightens the back up and actually tightens things up too much so that you don't ever really heal the back. So then we started doing crunches, and crunches are good abdominal exercises, but they really don't help you functionally because, first of all, most people are in a very flexed position most of their day. They're sitting. So we really need to go the opposite way and do things that strengthen the extensor muscles, which are the lower back muscles more than the abdominal muscles. And so this is where things like the plank really can be helpful in strengthening those muscles, and the bridges and the side planks. Those, I emphasize those because those are real important and easy for most people to do.
Mm-hmm. It does the plank requires a little bit of upper body strength because I do it myself. It's also common in yoga.
Correct. But if you have, so that brings up another point. That goes like, so what do you do if somebody doesn't have enough upper body strength? Well, there's ways to do these planks or bridges using a therapy ball so you don't have to hold yourself up. Mm-hmm. Or a bridge, you can actually be on your shoulder and lift your body up from your back, and you're on your upper back, and so you don't need your upper body to do that. So once again, it's working with the individual to see what their needs are, and so if they're weak in their upper arms, then that might not be a way to strengthen the core right off the bat. You have to individually strengthen the upper body and then try to do those planks as well.
So going on the upper body theme, do you recommend that people to develop a little bit more of that stronger muscles or tone their muscles? Do you recommend they lift small weights?
So I think, strength training should always be functional. And what that means is, a lot of people like to go toward the machines. Let me go into the gym and I'll do the machines. The problem with machines is they don't address how we use our body on a regular basis. If you are trying to lift up a grocery bag, you're not being guided to lift that grocery bag. You actually need your entire body, your lower body to your upper body, to lift up that grocery bag. So to answer your question, we do need to strengthen the upper body, but we need to do it in a way that includes functional movements. So I don't believe in machines. I'd rather use possibly some free weights, but body weight, most people just need body weight, resistance bands. That's all they need to really do to get their upper body stronger. So there's bicep curls, tricep extensions, kickbacks. You could do push-ups. You can do the push-ups on your knees if you're not strong enough to do it full body. These are all very important things, and women as a population have a tendency to have less upper body strength than men, so it's even more important for women to get stronger and do these exercises.
So all these things would help condition you, whether you've injured yourself or not, to move or reach and bend properly.
Yeah, well, that's another thing, bending properly. So most people bend, they pick something up and they bend from their waist, like as if they were going to touch their toes. And, if you watch a kid bend down to pick something up, they do a squat. They do a perfect squat to lift things up. And what we found is, if you look at societies in the past, that's how we did things when we're in the, and I'm going way back because before my time, when you do things in the field, you'd bend down from you bend from your knees, you get your butt back, and so you would do a squat to lift things. And so learning to bend from a proper squat would be the way to go. Now, if you have knee issues, then you could modify how you bend by maybe lifting one leg up so you're not locking your back up. So how you bend is very important. And most people, it's one of the ways they get hurt is they're bending and they're putting too much stress on the lower back, and their hamstrings are too tight and they're too weak.
Yeah, hamstrings are another common problem. We have a lot of runners in this area, and so it's possible, I would think, to overuse your muscles, and your hamstrings come to mind.
Well,
is that what you?
Well, interestingly, if we're talking about hamstrings, a lot of people come in with hamstring tightness, and because we sit so much, the sciatic nerve actually becomes entrapped, which they don't have sciatica, they don't have numbness or pain down the leg, but end up getting hamstring tightness because the sciatic nerve is not functioning as well, and it's actually tightening up the hamstrings. So you have to free up the nerve first, and then you could loosen the muscles up, and then you have to do hamstring strengthening, which would be sort of your your curls. I like people doing hamstring curls to start with on a therapy ball. So you lie on your back and you put your heels on the ball and you do a bridge where you lift your butt up and then you bring the ball toward your butt and you go back and forth. And as you straighten your leg, you end up slowly going toward your heels, straightening your knees, and that really is what helps strengthen the hamstrings.
Mm-hmm. So is that accurate, though, that, people who do a lot of running on concrete, what kind of injuries are you seeing with runners?
Well, once again, runners, hamstrings are a very common injury. The iliotibial band, which is the fascial and connective band that goes from the hip to the knee, and people will come in with either hip pain or mostly knee pain on the outside of the knee, and there's a little sac called the bursa that's underneath it, which helps things slide real well, that gets irritated from all the friction and pressure from the repetition of running. And so iliotibial band or IT band is a very common. The bottom of the foot, the plantar fascia, it's a thickening underneath the feet, and then you got like 4 layers of muscle underneath that are getting constantly worked when somebody runs. I see a lot of those injuries too, and it's a matter of building up foot strength. And unfortunately, most runners also are desk workers, so they sit all day, and those muscles and fascia just tighten up. And so then they go out and they run on those very tight muscles, and that's what actually causes the bottom of the foot pain, is the combination of not using it all day and then using it a lot. And that puts too much stress on those structures. So you have to then loosen them up, use the active release, break up the fascia, I use like little balls to allow people to loosen it up at home, do some stretches, and then do some strengthening, like grabbing a towel with your toes. That's one specific strengthening exercises for the feet.
Yeah, I think feet are probably neglected.
Oh, feet are totally neglected. Yes, I agree. And that's, you need your feet to move.
Absolutely.
That's what hits the ground. It hits the ground first, hopefully.
Right. So let's talk about a warm-up. You're an athlete yourself. What is your warm-up and cooling down routine?
So, my feeling about warm-up is exactly that. A lot of people think they need to stretch before. That really isn't correct. If you need to stretch, you stretch afterwards. Now, a good warm-up would be to actively move your muscles in a slower manner. So let's say you're a runner and you do a 7-minute per mile pace. You would start out maybe doing a 10-minute per mile pace to just get your body slowly moving and get the muscles ready for more active exercise. And you would probably do that for about 10 minutes until you feel warm enough and your heart rate is high enough to then start going at that faster pace. So I don't believe that, you shouldn't stretch necessarily beforehand unless you do something that's active or dynamic. So that's like a 2-second hold with a stretch and not more than that. And you do 5 or 10 repetitions of it. And that's another whole lecture on how to actively stretch.
So if someone like me who likes to just jog, pretty slowly, I'm not sprinting.
Right.
Would you recommend that I fast walk, power walk to warm up to the jogging, for example?
And that would be perfect. That would be exactly what you'd want to do in order to get yourself ready to do your slower run, is a nice strong walk for 5 to 10 minutes to get things powered and moving. Yes. Now, after your run, that might be a good time to do a little active stretching. So once again, I like, you can look this up. It's called active isolated stretching. I particularly like that, or some dynamic movement stretching, where there's a hold for 2 seconds, no more than that, and then you do that on a repetitive basis to get the muscles cooled down, so to speak.
Mm-hmm. So this would be stretching all the muscles that you would potentially be using. So it would be your calf muscles. It would depend on the sport. Sometimes I stretch my arms out. Because I'm a tennis player, I'll do some cross stretching with my arms.
Oh, absolutely. So you'd actually do your hips, because let's say tennis, you'd want to get your hips loose, so you'd want to do your glutes. You'd certainly want to do your legs, which are calves and hamstrings and quads. Yes, your arms. Your arms don't tend to tighten up too much. I mean, maybe your forearms, and so let me retract that. Forearms definitely need to get stretched, but not so much in your shoulders. I mean, I don't see that too much in tennis players.
Mm-hmm. Yeah, I think it's more repetitive. I think the arm that you serve with, assuming you're playing games and sets like I do, then that's where I've noticed some what I thought was repetitive motion soreness. It was in my right shoulder.
Absolutely.
Right-handed.
Absolutely. That's because you're going overhead, as well as the intensity and the acceleration, and it's followed by deceleration that's required of your muscles from the serve. So, yes, of course, the serving arm is more likely to take the brunt of injuries, and that's where we do see shoulder injuries in tennis players. It's always in the serving arm, or the dominant arm.
Right. Well, that makes sense. So are there any other tips you want to share with our listeners before we close out today?
Once again, I think the most important thing is to know, if you are injured, and you're not healing, you could do some stretching, you could do some strengthening, but, if things are not improving in 1 to 2 weeks' time, to know when to get help, you could do the foam rolling, you could do the stretching, you could ice yourself for 2 to 3 days, you can use heat after that to try to keep things moving. If you're not getting improvements, then you really need to think about following up and finding somebody who can help you with this and get your joints and your muscles moving properly so that you can heal better.
Mm-hmm. So we know that you specialize in ART techniques, but if someone was not in Northern Virginia, for example, or DC, is there a resource they can look up online to find a practitioner, an ART practitioner?
Yes. So there's a website. It's activerelease.com. And if you go to that website, there is a button that is Find a Provider. You can put in your city or zip code, and you will find a provider closest to you. And by the way, you'll see there are different icons next to people's name. And I would recommend finding somebody that is at least full body certified, which means their lower extremity, their upper extremity, and the spine all together. And those are 3 icons that are displayed. And there's also one for nerve entrapments, one for biomechanics assessment, one for master's touch, one for active palpation, and one for what we call complex protocols. I don't remember if I said nerve entrapments. That one too.
Yeah.
So those are all different icons that are displayed to show the different level of training that an individual has. So clearly, the more icons somebody has, the more likely they've been trained for some time doing it. I wish the website would say how long somebody has been doing the air active release, but it doesn't. So the icons is one way to tell if somebody's been trained for a long time, and you can see that by the number of icons. The other website I would refer to you is the American College of Sports Physician, American Chiropractic Board of Sports Physician, which you can find a sports medicine chiropractor that has additional training from just being a chiropractor to get the joints moving and also work on those soft tissues.
Mm-hmm. Well, those are excellent recommendations and resources. And I want to thank you so much, Dr. Skopp, for being on the podcast today.
Thank you, Christine.
You're so welcome. And listeners, you can also learn more about Dr. Skopp and his practice in Alexandria, Virginia on his website, Skopp, that's spelled S-K-O-P-P, Chiro, CHIRO.com. So next episode, my frequent co-host and fellow NTP, Amy Berger, will join me again to discuss nutrition trends such as resistant starch and dietary plans that are based on your body type. So thanks, everyone, and have a great, healthy week.